this video, I'm going to be doing a head-to-toe assessment on my client. So first, you want to make sure that when you enter the room, you have all your equipment ready, and it's all right here. You want to make sure you let your patient know what you're doing. I'm going to be doing a full head-to-toe assessment on you, and it's going to start with your head all the way to your toes. I'm going to be palpating, inspecting, percussion, auscultating everything. Okay, and then is that okay with you if I do
Yes.
so? All right, awesome. So you want to make sure that it's okay with them. You want to make sure that there's privacy for the clients, they feel comfortable. Lighting also is a very big factor. You also want to make sure that there is no broken arms, legs, any physical limitations on the client that could mess up how you handle the head-to-toe assessment. Okay, so the next thing we're going to do is we're going to do the mental assessment. So you want to make sure that the client is in clothing that matches the weather, which it's warm outside, so she's in shorts and a t-shirt. You want to make sure that her physical appearance is good, and then you want to make sure that she knows where she's at, her name, date of birth, who the president is. So you want to make sure to check the armband. What's your name?
Kayla Goen,
Okay, and the date of birth.
2/13/95.
Do you know where you're at?
Wichita Falls,
Okay, and who is the president?
Donald Trump.
Okay, so she's alert and oriented ×4. You also want to make sure that you check for slurred speech. Obviously, she wasn't slurring her speech, so that's intact. There's no drooping of the face, and that also she understands the thought processes of what's going on and what's happening. Okay, so now we're going to start with the skin. So you want to make sure to inspect her skin. The color, you want to make sure the color matches her ethnicity. It's pink, kind of darkish a little bit. And then you want to make sure to check the integrity of the skin, which you want to check the bony prominences, make sure that there's no lesions, anything like that. And then you want to make sure to check the skin turgor, which you can check on the hand, but you also want to make sure, you can also check it on the clavicle, which she doesn't have much on the clavicle, so that's what you would do. And then you want to make sure to check the temperature, which will be the dorsal part of your hand, and she's warm, okay? And then you're going to make sure to check the hands and the fingers and the nails. Her nails are pink, her nail beds, and then there's no clubbing of the fingers. And you're also going to check the skin capillary, the nail capillary refill, which for 2 seconds, it goes back immediately. Okay, so after that, we're going to start with the scalp. You would put gloves on at this point, but I'm in my friend's home and she's a friend, so I'm not going to do that. Okay, so you would go through her hair, check for lesions, the color of her hair, make sure it's washed, keep up with hygiene. Okay, her hair looks good. You want to make sure her head is symmetric to her body, cephalic to her body, so that's normal. And then you're going to check for cranial nerve 7, which is the facial. So you're going to have her smile, can you frown, blur out your cheeks, okay, and then clench tightly, close your eyes. Okay, there you go. Cranial nerve 7 facial is intact. And then at this point, you want to check cranial nerve 5, which is going to be trigeminal. And you're going to check the sensory and the motor. The sensory is going to be when you do the dull and sharp. So I'm going to be putting this on you, and you're going to tell me if it's dull, sharp, and you're going to point to it.
Okay. Dull.
Okay.
Sharp. Dull.
Okay, awesome. So the nerve is intact so far. And then at this point, you're gonna have her clench down on her back teeth, and you're gonna feel for the muscles and seeing if the cranial nerve is still intact. So I need you to clench your teeth. And that's gonna be the temporal and the masseter muscle. Okay, so that's all intact. So now at this point, we are going to start with the, give me a minute. So we're going to do the ears at this point, okay? So we're going to check the articular, and then we're going to check the tragus and the lobe. And do you feel any pain when I do that?
No.
Okay, so you want to make sure you do it on both sides. Make sure the ears are symmetric. There's no lesions. And then at this point, you're going to make sure to check the external auditory canal. You're going to check the color inside, make sure there's no drainage. There's a little bit of earwax, but that's okay. sure there's no bumps inside the ears and everything's intact. So at this point, we're gonna check cranial nerve 8, which is gonna be the auditory / vesta, could be the, I'm trying to think how to say it. Vesicular, okay, it's just the auditory. I'm just gonna say that, yeah, it's fine. Okay, so you're gonna do that by making sure that it's intact by doing the Weber, the Rhine, and the whisper test. So I'm gonna start off with a whisper test. So I'm gonna go behind you. And I'm going to whisper 3 things, and I need you to tell me what I'm saying. Okay, Christmas tree,
Christmas tree.
stocking,
Stocking.
bike.
Bike.
Okay, cranial nerve 8 is intact so far. Okay, so now we're gonna do the Weber test, and we're going to hit it. Hold on. So I'm gonna hit this, and then I'm gonna put it on top of your head, and you're gonna tell me if you can hear it in both ears.
Okay. Yes, I can.
Okay. So we'll let that go back to normal. Okay. And now I'm going to check. This is going to be that was the Weber test. Now we're doing the Rhine test, and we're gonna do air conduction. So hold on. I need to tell her first. I need you to tell me when you can't hear it anymore.
Okay.
That's gonna be the air conduction.
Okay. Okay.
Okay. All right. And then now I'm gonna check for bone conduction. I'm gonna put this right beside your ear and on the bone, and you're gonna tell me when you can't hear it anymore.
Okay. Okay.
Okay. So obviously air conduction lasts longer than bone conduction, so that's why she heard it on air conduction rather than bone. Okay. So now we're going to do the eyes. So at this point, I'm going to check the eyes, make sure they're symmetric, bilateral, there's no drooping of one eye, check the color, and all that. So before we do that, I want to say we did the Snellen chart before. We did this, and that is cranial nerve 2, which is optic, and it was intact. So I'm going to check the color, okay, making sure that they're symmetric, nothing wrong with them. And so now at this point, I'm going to check the Lackerman apparatus, make sure there's no discharge or drainage, looks good. And then I'm gonna do the conjunctiva, pull this down, and it's pink. And the sclera is white, which that's how it should be. So now I'm going to test the pupil response. So I'm gonna have you look right there, and I'm gonna make sure that your eyes, your pupils dilate and that they constrict. Okay, and they constricted. So now I'm going to do the consensual response, and that's going to be when I cover one eye and I check and see if it dilates separately. Okay. Okay. And now at this point, I'm going to check accommodation, and I'm going to have her, you're going to look at the stocking, and I'm going to make sure your eyes dilate. Look good. Okay. And now I'm going to do convergence, and that's going to be, you're going to look at the stock, look at my pen light, and I'm going to bring it closer to you, tip my pen light. Okay. Looks good. They look intact, symmetric, all that fun stuff. Okay, now I'm going to do the cardinal positions, which is going to be testing cranial nerve 3, 4, and 6, which is ocular motor, trochlear, and abducens. Okay, so you're just going to follow my pen line and do 6 different positions. Don't move your head.
Okay.
Okay, so let me start here. Okay, and they're intact. Response is good. Cranial nerves are all intact and all that fun stuff. Okay, so now at this point, I just realized I did, oh no, I'm not there yet. Ignore me, ignore me. Okay, so now we're going to move on to the nose and sinuses. So I'm going to, I'm going to check the external nose and make sure the color and shape is all symmetric and normal. So It's symmetric with the head. Color is pink, matches the skin. And now I'm going to palpate the external nose canal. Make sure there's no bumps. It's not inflammation on it. Anything like that. Looks good. So now I'm going to do the nair patency. You're going to check the inside of the canal, nose canal, and make sure that there is the nose is patent with the airflow. Well, however you say it. Yeah. Okay, so I'm going to hold one nostril and you breathe out the other. Okay, looks good. Okay, looks good. So now we're going to do the cranial nerve 1, which is olfactory, which is smell. So I need you to close your eyes. And I'm going to put this in front of you, and I need you to tell me what you smell.
Coffee.
Coffee. There we go. So it's intact. Okay, so now we're going to check the internal nose canal just to make sure the color and the mucosa and the turbinates that they're normal. Okay. Okay, so there's a little bit of nose hairs, they're symmetric, the turbinates are in the middle, they're not inflamed, there's no discharge, and it's pink inside. Okay, so everything's normal. So now at this point, we are going to check the mouth, which I'm going to go ahead and get this over here. Okay, so at first you're going to check the inspect the lips, and they are symmetric. They're pink, they're plump, all that. So I need you to open your mouth, and I'm going to check the teeth, make sure they're all intact. There's no bad breath, because if there's bad breath, that means there's a disease. Okay, so teeth look good. They're clean, no bad breath. And now I'm going to check the gums, and I'm going to check the buccal mucosa. Okay, gums are pink. All that looks good. Okay, and then I'm going to check the hard and soft palate. Open my mouth. Okay, hard and soft palate are pink. And then I'm going to check cranial nerve, do the cranial nerve 10 test, which is vagus. Yeah, I have a picture. Vagus. And that's when you watch and see if the uvula raises. So, there you go. And that's when they say off. We say off for me. Okay, looks good. All right, so then we're also going to test, look and see her tonsils. And she got her tonsils removed, so she doesn't have any tonsils. And then we're going to look at the tongue, inspect the tongue. Okay, and it's symmetric. Everything looks good. And it's roughened, it's not smooth, it's pink, all that good stuff, okay? So, now I gotta think what I gotta do, hold on. So now we're going to do cranial nerve 12, which is the hypoglossal, and that's where you put the tongue blade on and you push on their tongue and see if they can do it, sense resistance, okay? Okay, awesome, it's intact. And then now we're gonna do cranial nerve 9 and 10, which is the glossopharyngeal and the vagus, which is swallowing and the gag reflex. So we're not gonna check the gag reflex so the patient doesn't throw up, but we are going to check and make sure she can swallow right. So can you swallow for me? Okay, looks good. All right, so now we are going to do So we're going to inspect the neck at this point. So you want to make sure that it's symmetric, bilateral, there's no lesions on the neck, all that fun stuff. Okay, and then you want to make sure to palpate the lymph nodes. So it's going to be, I gotta remember this, prearticular, postarticular, optic, tonsillar, submandibular, submental, and then, I'm trying to think, submental, anterior cervical, posterior cervical, and supraclavicle. Okay, and that's palpating the lymph nodes. They weren't enlarged, so that's a good sign. Okay, so now at this point, I'm going to make sure I have my pen light. I'm going to palpate the trachea. Make sure there's no enlargement. You can feel it. Okay, and then at this point, you're also going to check for jugular vein distension. You're going to have the patient look down and turn to the right at a 45-degree angle, and you're going to use the pen light for this. Okay, and there's no distension, so that's good. And so now at this point, we're going to palpate the thyroid, which is behind the trachea. I'm just going to go behind, but and it's kind of hard to palpate, so just kind of expect that. Okay, looks good. So now at this point, I'm going to auscultate the thyroid. Okay, sounds good. And now you're going to palpate the carotid artery, which is going to be right here. You want to make sure you do it at one time so you don't choke them out, pretty much. Okay, and then you're going to auscultate the carotid artery. It's cool, I can actually hear it. That is really cool. Never heard that either. You learn something new every day. Okay, so now that we're done with the neck, we are going to go on to the arms and hands. So you want to make sure to, first part would be cranial nerve 11, which is going to be the spinal accessory. You want to make sure that they can lift their shoulders shoulders without resistance. Sorry, tongue tied. Okay, so I'm going to put my hands on your shoulders and can you lift? Okay, cranial nerve 11 is intact. And then now at this point, we're going to do the radial pulses. I'm going to palpate those. You want to use 2 fingers. Okay. And they're +2. They're symmetric and I can feel them both. Bilateral. Okay, now I'm going to do the finger grip test. I need you to just hold on to both my fingers and squeeze them as tight as you can. Okay, and that is checking for upper extremity strength. So now at this point, we're going to do the deep tendon reflexes. Okay, so I'm going to have your arm. And so right here, we're going to do the tricep. Okay, and now we're going to do the bicep. Will you relax your hand? Little arm in my hand.
Mm-hmm.
Okay, and now we're going to do the brachial radialis. Here, and then that's going to be, I'm trying to think. Okay, got it. Making sure I'm doing it right. Okay, so the cranial nerves are all intact. Their reflexes are good. They move with reflection, all that fun stuff. So now we're going to do the post chest and the posterior and anterior chest. Okay, so I'm going to have you stand up. Okay, I'm going to start with the posterior chest first. And I'm going to check for taccal fremitus. So I'm going to be putting my hands on the back of the chest, and I'm going to have you say 99.
99, 99, 99, 99.
Okay. So now at this point, I'm going to do chest expansion. You're going to put it underneath the diaphragm. Okay. Breathe in. Breathe out. Okay. Chest expansion is symmetric. So now at this point, we're going to do breath sounds. And normally you would do each side to side, but so the patient doesn't pass out, we're only going to do it on one side. And I didn't hear any wheezing, stridor, crackles, anything like that. Breath sounds sound great. Okay, and so at this point, I'm going to percuss the posterior chest. All sounds good, symmetric, bilateral, even. And now at this point, I'm going, while we're already on the posterior chest, I'm going to check for sacral edema. So you're gonna lift the shirt up. I'm gonna lift your shirt up. And you're gonna check back here and make sure there's no edema. Okay, looks good. There's no sign of edema. Okay, so now at this point, I'm going to turn you around and we're going to do the anterior chest. So at this point, I'm gonna check for sacral fremitus again. So I'm gonna start here, and we say 99 every time I move my hand.
99, 99, 99, 99.
Okay, sounds good, sounds even. Now at this point, I'm going to auscultate, like I did, and I'm only gonna do one sound. No, I'm gonna do chest expansion. Sorry, I messed up. I messed it up, okay? I'm gonna go right underneath the breast, and I'm gonna have you breathe in, breathe out, okay? Chest expansion is symmetric, looks good. So now I'm going to, I'm trying to think, I think I messed up. Hold on. Okay, I'm gonna look at the respirations, make sure that they're breathing on their own, they're not using any extra muscles to breathe, they're not slumped over, all that stuff. And then I already checked for the sacral fremitus. Now I'm gonna listen to breath sounds. And we breathe in and breathe out every time I move my. Make sure I have it. Okay. And you would normally do this on both sides, but we're not doing that thing so she doesn't pass out. So again, I'm gonna I'm going to percuss the front as well to make sure that it's symmetric, +2 bilateral, all that. Okay, all right, so now at this point, we've checked the breath sounds. They sound good again. There is no crackles, there's no wheezing, there's no stridor. They sound good. Sound normal. There's no adventitious sounds. I can't say the word exactly, so that's what, yeah. Okay, so now we're gonna do the heart. So I'm going to check for the atypical pulse with atypical impulse, which is going to be right here. Okay. And I'm going to listen to it as well. So good. Okay, now I'm going to auscultate the 5 heart sounds. So you can also, you're going to use the bell and you're also going to use the diaphragm to listen to all 5. So I'm going to start with using the diaphragm part. So first you're going to listen to the aortic, which is going to be in the second intercostal right space. So you're going to start here. Okay. And then you're going to go to the left side, and this is going to be the second intercostal left space, and it's going to be the pulmonary, which it was aortic, now pulmonary. So you're listening, and I'm listening with the diaphragm. And then I'm going to go to the third intercostal space, which is going to be Erb's point. Okay. And then I'm going to go to the fourth intercostal space, which is going to be tricuspis. I can't say it right, sorry. Okay, and that's on the right as well. And then I'm going to go down and I'm going to do the mitral, and that's going to be in the fifth intercostal space on the right as well. On the left, I'm sorry, left, I messed up, left. And the fourth intercostal space is on the left as well. Okay, and now I'm going to use the bell, listen to the aortic, pulmonic, Erb's point, tricuspis, and then mitral. Okay, so now we're going to move on to the abdomen. Everything sounds good, symmetric, and bilateral. Okay. All right. So now we're into the abdomen. You first want to inspect the abdomen. Okay. Make sure there's no lesions, no bruising, making sure it's symmetric. You want to make sure the umbilicus is with the color of it. In the midline, you can sometimes see the aortic, which I can't at this point. Okay. So now we're going to, after we inspected the pulse, all that, we're going to auscultate. That way you auscultate so it doesn't mess anything up. You're going to be looking for bowel sounds. And then we're also going to be doing the spleen, liver, and all that. Okay, so you want to make sure you start with the right lower quadrant. Okay, and you want to go to the upper right quadrant. Then you want to go to the upper left quadrant. Yeah, heard everything. Can hear everything. And then left lower quadrant. Okay, and then you're going to auscultate over the spleen. Over the liver. Over the aorta, the renal, which is on both sides, and the iliac. And at this point, you want to make sure it's tymphatic. Sounds tymphatic. Okay? So now at this point, we're going to percuss, and then after that, we will palpate. So you want to percuss. Make sure there's no dullness, which there is on, sorry. Okay, and now I'm going to percuss. And make sure if there's an enlarged spleen that you don't do it over that because it could rupture and then yeah, it'd be very bad and then I wouldn't know what to do. Okay, so that all looks good. So now we're going to do the legs, feet, and toes, okay? So you're gonna make sure you're gonna start off with inspecting, making sure that there's no pitting edema, anything like that. The skin fits with the skin color fits with the rest of the body. That there's circulation, okay, and then you also want to make sure to check for temp with your dorsal part of your hand. It's warm, matches the rest of the body. Okay, and then you're going to, okay, you're going to check the, trying to think of how to say them. The Dorsalis pedal pulse. So you're going to check that right here. The dull end. No, hold on, I'm trying to think. Okay, the sharp end. Okay, check the pulse. Okay, and you're going to check the back, the posterior tibia pulse, which is going to be right here. So you check the posterior, dorsal, and then the posterior tibial pulse. Okay. All right. So those look good. And so now I'm going to have you do the heel to toe shin test on both legs. Okay. Awesome. So can I have you sit up and then dangle your feet over the couch? Okay. And then we're going to check the reflexes in the patellar. So you're going to use the sharp of the dole. Okay, so I'm going to do the dole. Okay, and you'll make sure to do it on both. Okay, and then now I'm going to check the Achilles reflex. Okay, which is going to be right here. Okay, they both rise when they're supposed to. Her reflexes are intact. And then I want to make sure to do the capillary refill on the toes, which you should have done right there when they're not dangling their feet. So just keep that in mind, okay? In the toes, there's no cracking in the nail bed. They're intact. And then the capillary refill on the toes goes back immediately after 2 to 3 seconds. So it looks good. And then you're going to do flexion and extension, flexion and dorsiflexion of the foot, okay? So against resistance, okay, yeah, against resistance, so, okay, looks good. Okay, so those are intact. Her reflexes are intact. Okay, so now at this point, we're almost done. Sorry, almost done. We're gonna do the balance. So go ahead and have you stand up. And if you'll go ahead and walk towards the camera, normally, this is going to test the gait. Okay, and if you'll walk back to me with your heel to your toes, yeah. Okay, her gait is intact. Okay, and now at this point, you're going to stand, and we're going to check the Romberg test. You're going to have your arms up, stand like that, and there's no swing, so it is negative. And that's how you do a head to toe assessment.